Good day, class. Today's discussion 2 is focused on the 2008 UCLA medical records breach. The question before us today is how do we properly train and ensure accountability to protect our patients' records? It is our responsibility to ensure that the patient's care and corresponding medical records are safeguarded, to ensure confidentiality of the patient information, and to also comply with HIPAA and HITECH rules. These rules have been established to provide privacy requirements and guidance so that there is no question of confusion when it comes to what you can say, who you can say it to, and from a technological piece, what you can view and when you can view it. HIPAA, the definition, is the Health Insurance Portability and Accountability Act. Can plainly be defined as simply protecting one's privacy. The Health Information Technology for Economics and Clinical Health Act, or HITECH, is another simply defined as when you have computer technology and computer information documents regarding a patient, it must be protected in the highest of confidentiality. Let's take a little bit of a look at the background from the UCLA health system. This was reported in 2004, and that between 2004 and 2006, nearly 120 employees inappropriately viewed medical records. What exactly does this mean? So first off, we have to understand electronic medical records. What is an electronic medical record? Well, an EMR is a system of identification and record maintenance that protects the integrity and the authorization and protects the security of records and their entries. But what it really basically boils down to is when a patient walks into your hospital, the EMR is the admissions history, the assessment, the patient orders, the daily assessments, the plans of care, the discharge planning, patient and family education, and it may even include dietary, food and nutrition, and other support service components. Basically, it removes paper from the medical system, and it takes all of the information and stores it in an EMR. And the importance of this is that it must be protected, as the files provide confidential information such as social security numbers, medical conditions, so on and so forth. Who typically has access to an EMR? It depends on the hospital, but most times it's typically nurses, physicians, techs, anyone from a clinical standpoint that would come into contact with a patient and have to make an entry into the patient's system. So let's have a little bit of an explanation on this. If a nurse completes their assessment, the nurse has the right to enter into the EMR and document that the assessment was made. Same thing goes with a physician. If a physician conducts his or her assessment, decides to place new orders for medicine, those orders and the assessment would be done in the electronic medical records. Now, if a doctor, for some reason, is treating a VIP patient and reviews their medical record, enters it, and is placing an order for that patient, and then decides to look at the patient's financial background, that technically is considered a breach of the EMR system. And that is defined as such because the doctor stepped out of the parameters of his role and responsibilities. However, if you flip the coin, if a finance person who is working to close out the insurance for this VIP patient enters the EMR and only goes into the finance section, they are not in violation and they are following the rules accordingly. Most EMR systems track keystrokes, so that means that if you're a nurse or a medical provider that enters the EMR, all of your click strokes and keystrokes will be documented, and it will also demonstrate how long you were in each section of the EMR. So, as a nurse, hypothetically, I enter into our Professor Rutledge's medical record, and I decide to look up his finances because I wanted to see how wealthy he was, all of those keystrokes would be documented. Now, typically, all you would find in the EMR would be the patient's social security number, the patient's method of payment if one did not have insurance, but you would not find things such as a credit report or anything like that. Unauthorized disclosures of patient information, regardless of if it's believed to be a breach or is a breach, it is always and should always be treated as a breach so it can be investigated. So what does this mean? How do we prevent all of this from snowballing into the UCLA crisis? First, you have to create the policies. You have to write the policies to state what the purpose of the EMR is and what happens when you violate the policies. Creating confidentiality agreements, creating statements of policy to state that you in your role can only enter into these sections of the patients. You then have to empower the team. You have to give them the resources and the trust that they are going to follow the rules. And you have to provide to them the opportunity to report failures. For instance, there is a system known as KeepSafe at my institution. KeepSafe is a confidentiality reporting system. If I see that John, a nurse, is entering inappropriately into another employee who was admitted as an inpatient into their medical record, I could go into KeepSafe and report John the nurse, and I would not have to give any of my information. That would then be transmitted to a privacy officer, who is a manager at the hospital that conducts investigations on breaches into patient security. They provide regular audits, and they provide oversight and compliance to ensure that the system maintains its integrity. So with all these aspects and everything that comes together, here are the key points. You have to focus on training and education, but you also have to empower your team. You have to give them the trust, but you have to explain and demonstrate that accountability is key, and that they have a power, unlike many others in the hospital, in which they can enter into this information. However, one step outside of the line can result in immediate termination, and beyond that, in some states, there are criminal proceedings that could occur. In a hospital setting such as where I work, if an employee is found to be possibly breaching other records, it would be reported either through KeepSafe or to a supervisor or manager, and it would be sent to the privacy officer, who would conduct an investigation within 24 hours. The privacy officer would then reach out to the employee, and the employee would be suspended. The access would be suspended, and the employee would be investigated and questioned on their policy on why they entered the record. In some instances, it can be dealt with progressive discipline. In other instances, it will need to be dealt with much further, such as termination. We have to be careful to understand that situations like this can snowball into a very serious and large nightmare similar to UCLA's. And I liked the CEO's point-blank statement of saying, "We messed up, plain and simple. We have no excuses." Dr. David Feinberg, Chief Executive of the UCLA Health System. "We should have detected the violations years ago, and we should have immediately initiated the process to dismiss those employees." So with that being said, I hope you've enjoyed my presentation, and I will answer any of your questions and be glad to go into further detail. Thank you.